Southern China is currently grappling with a significant public health crisis that has caught the attention of both local and international communities. At the heart of this crisis is a large chikungunya outbreak, with the epicenter located in Foshan, a major city in Guangdong province. This region, known for its bustling urban centers and economic activity, is now facing an unprecedented health emergency. The combination of a dense population and a warm, humid climate has created ideal conditions for the rapid spread of chikungunya. As a result, the number of reported cases has surged in recent weeks, leading to growing concern among residents and health officials alike. Both Chinese authorities and international health organizations have responded by issuing urgent alerts and advisories. The U.S. Centers for Disease Control and Prevention has issued a Level 2 travel health notice for the region. This means travelers are being urged to take enhanced precautions, such as using insect repellent and wearing long sleeves, to reduce the risk of infection while in affected areas. Chikungunya is a viral disease transmitted by mosquitoes, particularly the Aedes species. It causes sudden onset of high fever, severe joint pain, muscle aches, and fatigue. For many, the pain can be debilitating and last for weeks or even months, making it a growing concern for thousands of people in southern China. Local healthcare systems are feeling the strain as hospitals and clinics see a sharp increase in patients seeking treatment for chikungunya symptoms. Daily routines have been disrupted, with public health messages urging everyone to stay alert, seek medical care if symptoms appear, and follow prevention guidelines. The immediate priority for authorities is to stop mosquito-to-human transmission. This requires coordinated action from government agencies, community organizations, and individuals. Efforts include spraying insecticides, eliminating standing water where mosquitoes breed, and educating the public about protective measures. In this video, we'll break down what chikungunya is, who is most at risk, including the elderly, young children, and those with weakened immune systems, and the most effective ways you can protect yourself and your loved ones from infection. Remember, knowledge is power. By staying informed and taking simple precautions, we can all play a part in containing this outbreak and keeping our communities safe and healthy. Chikungunya is a viral disease transmitted by the bite of infected Aedes mosquitoes, never directly from person to person. The name means to become contorted, describing the severe joint pain it causes. Symptoms appear 3-7 days after a bite. Media group: person checking thermometer with worried expression, person lying in bed appearing ill, person clutching joints in pain at it distribute _equally, sudden high fever, intense joint pain, headache, muscle aches, swelling, and sometimes rash. Most recover in a week, but joint pain can linger for months or even years in some. There's no cure. Treatment focuses on relieving pain and fever and getting plenty of rest and fluids. Diagnosis is confirmed by blood test, which helps distinguish chikungunya from similar illnesses like dengue or Zika. Prevention hinges on avoiding mosquito bites and controlling mosquito populations. Over 7,000 people in Guangdong have been infected, making this a true public health crisis. The disease's severe joint pain and fever have left many bedridden, unable to work or care for their families. Hospitals are overwhelmed, with resources stretched thin as they manage the surge in patients. The outbreak's impact ripples through the economy and daily life, creating anxiety and uncertainty. Public health officials are racing to contain the spread and support those affected. The psychological toll is real. Worry about long-term pain and the health of loved ones is widespread. For some, chronic joint pain persists, affecting quality of life long after the initial infection. The true cost of this outbreak is measured in both numbers and human suffering. Chikungunya is a disease that can affect anyone, regardless of age, gender, or background. However, certain groups of people are much more likely to experience severe symptoms or complications if they become infected. Understanding who is most at risk is crucial for both individuals and communities, as it helps guide prevention efforts and medical care. Newborns who are infected around the time of birth are especially vulnerable. Their immune systems are not fully developed, making it harder for them to fight off the virus. Pregnant women are also at higher risk, as chikungunya can be passed from mother to baby during childbirth, potentially leading to serious health issues for the newborn. Older adults, particularly those over the age of 65, face a greater chance of developing severe symptoms. For them, chikungunya can cause intense joint pain that may last for months or even years, and it can also lead to other long-term health problems. People living with chronic health conditions, such as heart disease, high blood pressure, or diabetes, are also at increased risk. Their bodies may have a harder time coping with the infection, and chikungunya can make their existing health problems worse, sometimes leading to hospitalization. For these high-risk groups, chikungunya is not just a temporary illness. It can trigger complications that require ongoing medical attention, and in some cases, it can even be life-threatening if not managed properly. That's why it's so important for caregivers and families to be extra vigilant. Simple steps like using mosquito nets, applying repellent, and making sure living spaces are protected can make a big difference in keeping vulnerable loved ones safe. It's important to remember that even healthy, active people are not immune. Chikungunya can cause severe joint pain and fatigue in anyone, sometimes making it difficult to work or go about daily life. That's why prevention matters for everyone, not just those at highest risk. By focusing resources and education on the most vulnerable groups, communities can help reduce the overall impact of chikungunya. Public health campaigns, mosquito control efforts, and community support all play a role in protecting those who need it most. Early recognition of symptoms and prompt medical care are essential, especially for high-risk patients. By staying informed and taking action, we can all help reduce the risks and protect our communities from chikungunya. The best defense against chikungunya is preventing mosquito bites. Use EPA-registered insect repellents with DEET, picaridin, or oil of lemon eucalyptus on exposed skin, especially during the day. Wear long sleeves, pants, socks, and shoes. Light colors are less attractive to mosquitoes. Treat clothing and gear with permethrin for added protection. Keep mosquitoes out of your home. Use air conditioning, repair window screens, and sleep under insecticide-treated nets if needed. Eliminate standing water around your home. Empty flower pots, buckets, and clean gutters regularly. Change water in pet dishes and bird baths weekly to disrupt mosquito breeding. These simple steps can dramatically reduce your risk and help protect your community. Prevention is a shared responsibility. Everyone can help break the cycle. Consistent action is the key to staying safe. Until recently, prevention meant only mosquito control, but now vaccines offer new hope. 2 vaccines, XGQ and Vimkunya, are licensed in the U.S. for adults and adolescents, providing protection for travelers and those in outbreak areas. XGQ is for adults 18+, while Vimkunya covers ages 12 and up. Vaccination is especially recommended for those heading to high-risk regions like Guangdong. Consult your doctor before travel. Vaccines need time to become effective. Note XGQ use is paused for people 60+ due to rare side effects. Vimkunya uses a different non-live technology. Most people benefit from vaccination, but always discuss your health and travel plans with a healthcare provider. Vaccines add a crucial layer of protection beyond bite prevention. If you're planning a trip to Guangdong or any area experiencing an outbreak, it's important to take extra precautions to protect yourself and those around you. Outbreaks can change rapidly, so always check the latest travel advisories and updates from health authorities before you go. Schedule a visit with your doctor or a specialized travel clinic well in advance of your departure. Ask about recommended vaccinations, preventive medications, and any specific health risks in your destination. Your healthcare provider can give you tailored advice based on your health history and travel plans. When packing, make sure to include a strong insect repellent containing DEET or another proven ingredient. Bring enough for your entire trip, as it may not be readily available at your destination. Also, pack long-sleeve shirts, long pants, and socks to minimize exposed skin. Choose accommodations that offer air conditioning or have well-fitted window and door screens to keep mosquitoes out. Inspect your room upon arrival and request a mosquito net if needed, especially if you're staying in rural or less developed areas. Remember, mosquitoes that spread diseases like dengue and Zika are most active during the day, particularly in the early morning and late afternoon. Stay alert and reapply repellent as directed, especially if you're spending time outdoors. Whenever possible, avoid outdoor activities during peak mosquito hours. If you must go outside, stick to well-screened or air-conditioned areas and wear protective clothing. If you develop symptoms such as fever, joint pain, headache, or rash during or after your trip, don't ignore them. These could be early signs of a mosquito-borne illness. Seek medical care promptly and be sure to inform your healthcare provider about your recent travel, as this information is crucial for accurate diagnosis and treatment. For pregnant women, the risks are even higher. Diseases like Zika can cause serious birth defects, so it's strongly advised to avoid non-essential travel to outbreak zones. The health of your baby could be at stake. If travel is absolutely unavoidable, consult your doctor about all possible risks and prevention strategies. Vaccination is usually deferred until after delivery, so extra caution is needed. For expectant mothers who must travel, strict mosquito bite prevention is essential. Use repellent, wear protective clothing, and sleep under a mosquito net if necessary. Ultimately, the safest choice is to postpone travel until after the outbreak has passed, or until after your baby is born. Your health and your baby's well-being should always come first. Chinese authorities have launched aggressive mosquito control campaigns, spraying insecticides and eliminating breeding sites in cities like Foshan. Public awareness drives urge residents to remove standing water and keep homes mosquito-free. Health workers inspect neighborhoods, helping communities clear potential breeding grounds. Hospitals receive updated guidelines to manage and support chikungunya patients. Enhanced surveillance tracks cases and directs resources where needed. Clear communication keeps the public informed and reduces panic. Success depends on both government action and public cooperation. The chikungunya outbreak in Guangdong is serious, but most people recover fully within weeks. Still, the risk of chronic pain and the strain on communities make prevention critical. Simple steps, using repellent, wearing protective clothing, and eliminating standing water, are your best defense. Vaccines now offer added protection for travelers and those at risk. Public health is a shared effort. Authorities control mosquitoes, but individuals must protect themselves and others. Stay informed, take precautions, and encourage your community to do the same. Prevention is always better than cure. Your actions matter. Together, we can help stop the spread and protect our health.